maybe the first question to Anita about who pays.
Yeah, I was meaning about the access the patients have to these wearables. Also the training for, I, for example, have one, but I don't know if there are studies that provide these wearables to patients, because not everybody can afford them. And also if there are studies that can guide you on which wearable is best for you, depending on the outcomes you want to achieve.
Yeah, Marta, they're very good points. There are studies, they're usually looking at a well-defined group of people. And so knowing how much that applies to you, it can be difficult. I think the simpler, the better. So for example, I know Apple Watches are expensive and some people don't have them, but if people have them, then they can, you know, if people have palpitations, they can get a sample of data. So using what people have, if they haven't got that, then I know, for example, in the virtual wards and for other monitoring of respiratory conditions, it has been possible to bulk buy oximeters, and so they can be used at home. But there's no standard answer because they're evaluated in different situations, and I think it's a discussion to have as to what will suit you best in your circumstances. And yes, some of them are very expensive.
Thanks, Anita. Stefano asked a question about the accuracy of these home monitoring things, such as, I mean, he mentioned spirometry specifically. I mean, how accurate are they? What is the difference between coming into a consultation room and having your spirometry taken, or sleep monitoring, as opposed to doing it with a remotely with some of these new tools? Could you comment on that?
Yeah, two things to say there. There was one study looking at impact of drugs on pulmonary fibrosis that found that the home spirometry was less good. However, subsequent studies, and depending on how you do those studies and the equipment you use, showed that they were just as effective. In fact, what you're wanting to see is the change in an individual rather than the absolute measurement. And so for looking at those sort of changes over time, then if things are slightly less accurate, that may not matter greatly because it's a change within the individual. But I think the equipment we have is improving all the time and is becoming accurate enough to make good decisions on. Thanks.
Right. Kel, did you have a couple you wanted to ask?
Yes, so I think Shane had some comments on how we actually prepare patients to participate in this digital health systems. So, and I think that touched very nice with Pascal's point about patients moving from being order takers into being more active team members. So I wonder, Shane, if this is something that you wanted to expand upon.
Yeah, actually it's super important, because at the moment we're all moving in very fragmented environments with mini studies, with or without a device, at the early stages of take-up of digital resources. But unless we get much more involved and participate actively and share what will be huge amounts of data to get to personalized care, not just ourselves, but from devices, from wearables, from equipment, from clinical tests and so on, unless we really take on that cultural change, we're not going to shift anything very quickly. So I believe it's very important, and I'd like to hear the opinion of the speakers and yourselves.
So Pascal, would you like to address this?
Yeah, sure. Thanks, Shane, for the question. First of all, I think that the costs of wearable sensors and trackers may still be prohibitive for a lot of people, but I think they will be subsidized in the long run if you're participating in a clinical trial, or if you're part of a state program to reduce inflammation on this and that. so I think this is a question now. It may not be in about 5 years' time. And then Shane, what was the second part of your question?
Well, I think it's our commitment to understand how we interact with digital. I think there's still a lot of reticence, but unfortunately, unless we exchange information, and that information that's exchanged is obviously translated into a format that it's meaningful for the clinicians to take that shared decision making, the onus is still on us to be much more active in sharing our data and be less scared about it, be less frightened. You know, most of the environments we're in are trusted. Facebook isn't actually. And what we achieve in Facebook, okay, social support in trusted environments is great. But when we're talking about clinical data, clinical information, how we're coping daily, etc., all that information is a huge, important repository. But people actually have to commit to doing that. And that's a challenge, I find, in people actually doing it.
Is it a challenge, or are we making it a challenge? I remember seeing some early findings from patients like me saying that as high as 75% of their patients registered on the website would be happy to share their data with anyone, including pharma companies, so commercial companies, if it helped people with the same condition. There is a solidarity between patients, and for a lot of them, sharing their data is a small price to pay to make it better for everyone. This being said, there's a question of trust that needs to be addressed, and trust is very sensitive. Actually, if you look at the map, if I could make a map of trust in Europe, I think some regions would be in red, some regions would be in green, but all the colors in between. We have different trusts in our health systems and in our government in general. And I think this is something that is very important, because you build trust over time, but you can kill it in one day. You make one bad move, and this is all the work that you've been, trying to elaborate over the years, that goes down. So trust is a very important issue. And it's we have a very diverse group of people here, so I'm sure they have different opinions about how trustful they are with their health system. But this is definitely an important question. The point is that patients are generous, and they're generous with their data. And if they think that it can make a little difference in the cures or the treatments that comes to the next generation, they will not hesitate.
So thank you so much, Pascal. Pippa, do you want to?
Yeah, well, I think we're going to have to close up the question and answer, because we're running behind and we want to have a quick break. So perhaps one last really quick question to Anita. Is there a difference in costs, do we know, of face-to-face to virtual? Is it cheaper to do these remotely, or actually because we're taking up the same amount of time of healthcare professionals, there isn't much in it? And do we know that?
It depends cost to whom. So for the patient, it should be much less expensive. You haven't got the time invested in travel, and you haven't got the expenses of that travel. despite that data I showed you on the timing of consultations, it's currently estimated that it takes the same amount of time for a healthcare provider to do the consultation, because there's the logging of the stuff afterwards. And so so you don't save time for the healthcare provider. I think what I would like to say is they're different. We're not trying to put them head to head. Certain circumstances will definitely require face-to-face for examination, if you need an x-ray, a blood test, whatever. So it's finding the right place for remote versus the face-to-face consultation, rather than necessarily doing head to head.